So again, welcoming you all to the post-C T session, not C. This is going to be an interesting. Please write it out and pass it on to me. Otherwise, we will go ahead with that. So, Sridharan sir, vanakkam, and vanakkam Maruti sir, vanakkam Kathy Davis, vanakkam Dev Sinamis, and vanakkam sir. So, first question I think I would like to put it to Sridharan sir. Sir, you have such a vast experience in yoga therapy. So what would you think are the basic principles that we need to adopt to or follow when it comes to yoga chikitsa? What would be the basic principle that you want people to follow or remember?
With very vast question, It is, even though I put it, actually I was telling in the morning, my idea was that, basically when you talk about two principles, one is, I feel, the principles for the therapist, the one who wants to call himself or herself a therapist. And second, principles for the seeker, care seeker, who is going to take the therapy. This is a bit very clear, I am clear. See, both number one principle is number one, and on which no compromise is practice. And number one, underline practice, practice, practice. Both will have to do. I cannot say that I have been doing yoga for 45 years or so. Now I cannot say that I have done and I am retiring. I will not. I will only give therapy classes and all that. So every day the practice must be done. Both. If I give someone a course, our teacher, what he has told us, what we are following, they will have to follow. In fact, people like our Yogacharya, Krishnamacharya, Desikacharya and all, they will be very, very strict. They will not even give the second class. They will say, no, you go and practice and come back. So when you practice, you intensely go into the system. It should be in that way. It is not simply physiological factors like I am feeling better. Are you able to have calmness? Are you able to feel different? And second is, it is people who are around you who should be able to say. These are all things. So practice. How many times is the point? Every day. One time people will say, I would say that it should be 3 times divided into morning, afternoon and evening. Therapy, if you want therapy to go intensely and work, it should be. You can't do 10 minutes in the morning and say it is not working. Because it is therapy and the intensity of the illness is also important. And if it is medicine, you take 3 times and you take higher dosages and all that. 3 times a day. This is based on the ancient principle of Sandhya Vandana, which is Ashtanga Yoga model. And any yoga therapy will have a component of dhyana. So, second. In fact, Krishnamacharya in one of his works says, Yame yame pranayamam. Yame yame pranayamam. Jasha dasha kuryat ayur vriddhihi. And he gives the indication. Yama means 3 hours. He says every 3 hours do 10 pranayamas if you want. See, ayur vriddhihi means it is not that I am going to extend my lifespan. Here the vriddhi is removal of illness. So practice, intensity, time factors, both must practice. Both the therapist as well as the person. It must be practiced in such a way that I should be able to see some changes happening in me, and that's an evolution. As well as a therapist, I see my evolution happening in me. And I'm able to see certain things more differently from then what I was doing 40 years back, certainly, from yesterday to today. Number two, are all therapists, because people are here, I would like to say, are you able to handle your illness with yoga? See, it is not like I have known, with due respect, maybe a cardiologist gets into a problem with his back pain. He will say, I am a cardiologist, I will go to, yoga is not like that. Not that you should have the same illness, but you will have some illness. There is no one who has no illness. No one. Are you able to handle your illness? If only when you handle your illness, you will know how therapy is working. It can be a different issue. As I have been telling in the morning, the problem is not disease-oriented, individual-oriented.
So, if you don't mind, I would like to add, I being a surgeon and practicing allopathy and also conducting yoga therapy classes for last 25 years. So I have made little bit description about that. And initially when I wrote the book Yoga Therapy, and I had covered all the diseases in that and all yoga practice, you can do that. So when I published that book, there was a lot of not controversy, but reactions with the real yogic people. So in that book I have said, when you are starting yoga therapy to any patient, you should know your limitations. So what are the limitations? So you should not use yoga to any patient who has got acute illness. So you have to differentiate between acute illness and chronic illness. Now in my book I have given sometime other time there are, just for example, acute heart attack, then status asthmaticus, then severe loose motion, severe vomiting, severe abdominal colic, perforation abdomen. All these are acute conditions. They cannot be treated by yoga. So leave it aside. Don't try to, no, I can treat. And another thing, the mechanical difference. Hernia, hydrocele, then hiatus hernia, heart wall defect. These are all mechanical. You cannot cope up with the yoga. So leave them aside. So first thing, you should leave aside all the acute conditions. Once patient goes into chronic condition, then you can venture with the yoga. But that too, you have to do step by step. Now, what your yoga modules you have given in my book also, or you also might be telling. So that should not be given on the very first day. As you said, that you should see, watch every day, that he is able to do it or not. Because as you say, it should not harm the patient. It should give the benefit only. So you have to watch every day. You cannot implement whole act of yoga only on the first day. Second thing, you cannot ask him to practice the, suppose you take Bhujangasana. So the final stage of Bhujangasana you should not practice on the very first day. Let it go 8 days, no problem. Then in heart attack, nowadays since yoga has become very popular and very famous, people are, so I do get call from the patient, he is discharged from the ICU and next day tells me, I had a heart attack, I have been discharged and I heard that yoga can treat with so come and teach me to work. Can you teach yoga to that patient who has been just discharged yesterday from myocardial infarction? So this categorization is very necessary. So if you follow the principles of yoga therapy, what should be the limit? You should know the limit, you should know the contraindications, which patient you cannot do yoga and which patient you can do, if you can do, what yoga practice you can do. Thank you.
Thank you, sir. So care provider and the care seeker, both of them should keep up the practice is what you're saying, the intensity, and as sir said, we need to know who it should be applied on and not everybody, right? So my next question would be to...
I had to comment some same thing. Not harm patient only, but for yoga therapy also, reputation. That's just there. See, in general, the acute emergencies, surgical, medical, gynecological emergencies are out of yoga therapy. And surgery in general, surgical cases. So that's why yoga therapy is best for doctors. Best yoga therapy, that's there. And say for the same level of, for example, yoga knowledge and experience, doctor is the best. And not only yoga therapy, see, one of the earliest pioneers in yoga is Swami Shivananda. He was a doctor, medical doctor. That time, 3 years only they were there. And so we have to know our limitation. And if you work in suppose in a hospital together, the group practice the best. You are Ayurveda man, naturopathy man, a yoga man, and that's best. That should be aim. And also our aim should be to yoga therapy, I mean, for doctors. And the therapy, see, we must know what therapy can be done by non-doctors. Like what therapy nurse can do. Physiotherapists can also do therapy. They also do therapy. So it should be very much clear. What is yoga therapy for doctors is different, higher level, if he's a yoga man. And for others, minimum. Basic. Earlier signs, like this, you say, what is early, what do you call the early, the medium, what do you call that? In the beginning, no, and then it becomes, first is the psychophysiological, then pathological.
Psychic,
Psychic.
somatic and all that.
Psychic stage are fine, no problem there. Still.
There is one more question to Sridharan sir. As an adjuvant therapy, example like a monotherapy, which one is better? In the panel's opinion, sir talked about Eka Tattva Abhyasa in the morning, but modern medicine talks about holistic approach. So, which one do you think?
What? Mono? What is the first line?
Monotherapy, adjuvant therapy.
No, yeah. Mono means only one. Yeah, very good point. In fact, if this question has not arisen, I was about to talk about it. In the same convention, in another situation, in the ground floor there was a... You see, basically we are moving towards integrated therapy. Let us understand very clearly, that is what the other way of calling salutogenesis, another way. At the level of the result it is salutogenesis. At the level of application, it is integrated therapy. Let us understand one thing. We are a therapist, there are doctors. How do you know whether the caretaker you are saying is not going to another doctor or another this thing? There is no way. You can't take a letter from the person that I will not go and all. They will do anything. Let us understand reality. They will come to you, they will go into Ayurveda, they will go to somewhere else. So knowing this, they said integrated therapy. Let us try to understand, ask the person plainly, are you going, what are you doing and all. In integrated therapy, you can, now the research is only on that. How can you integrate one and the other? We did it about 30 years back when Besikacharyya asked everyone to come to KYM, and we did a complete seminar on integrating various systems, 35 years back. And we published it in Hindu, and it has become as a book called Yoga of Healing. At that time, I was sitting in the moderation. I was sitting now and taking notes of everything. See, the allopath doctors generally do not like Ayurveda, Siddha, Unani anywhere, because they are saying, they are giving chemical, I don't know what is happening. So they call invasive, non-invasive. They say if you go to yoga, no problem, because they are not giving any chemical. Similarly, Reiki or any other thing. So they divide it as invasive, non-invasive. So integrating yoga with anything generally will go back. Of course, removing these risks in the yoga, that we are there. We are taking that we are going to the right place for the yoga therapy. Take anything else. So there is no monotherapy there. It is integration. And want to tell you one thing, how does yoga, yoga, in fact the word yoga therapy, yoga sikitsa has some limitation also. As I was telling you, I am not addressing a particular illness. I am not saying removing the illness. I am addressing the system as a whole, and a person comes to me and he is taking a course for back pain. After 1 month or so, he says, I had a gallbladder and the stone is not there now. What happened? What happened to that? A person who is taking this thing for neck pain says that some other measures have come down. So the whole system is working. That is what yoga says. It's a whole system which is working together. So I am saying one thing, let us understand, doctors particularly, because I am sitting in a medical university, understand that we are removing a lot of impurities from the system. If the impurities are properly removed through the pranayama, you don't have to do a lot of hands exercise and all. On the other side, music side, I was very happy to see she was talking about a lot of important things. Like I have a fire here. I want to use the fire properly to remove the impurity. So you give a medicine, that medicine will work better. So you take two sets of people, give them medicine without yoga, give these people with medicine with yoga, and see that the medicine will work faster. Number two, the medicine also creates toxins. They will be removed. That is the idea.
This is a very beautiful answer, because this is the core principle of integrative medicine. It is not a competition between systems, it's a collaboration between systems. So we have to move from competition to collaboration. And this is where most of the work done here is as yoga as adjuvant therapy, not as a monotherapy. So someone coming here with a psychiatric illness, we don't say we only give yoga, we say let the psychiatrist give his medicine, along with that we give yoga therapy, and we find the benefit. And this is actually one of the beautiful works that Dr. Rama Reddy sir has been doing. Maybe you can make a comment on that, sir. I request you to make on how this concept of collaboration and argument is working, especially in psychiatry.
Yes, sir. Sridharan sir has given a beautiful answer. The doctor's approach would be invasive and non-invasive, because, for example, along with my psychiatric medicines of modern system, somebody says that I am taking homeopathy also along with it. Would you approve? I don't have any misregard towards the homeopathy, but I don't like, because I know the properties of my system, they know the properties of their drugs. And see, it is something like acid people know the properties of acid, and alkali people knows about the properties of alkali. But when the both are mixed, a different salt will form which do not have the property of acid or alkali. Similarly, my medicine and homeopathy medicine, although they say they don't have any drug interaction or they don't have any side effects, naturally it would be chemical. No, we take at a different time, they say. All the things go into the blood only. No, not for psychiatric condition, for arthritis only we will be taking Ayurvedic medicine also. Even that also, that will have the systemic effects, we say. So as far as the yoga is concerned, when somebody says yoga doesn't have any invasive things or so, it is not a chemical, it's going to be an adjunct. And similarly here, for our schizophrenic people, they got so much benefited. I was even a bit skeptical before starting the thing, neutral about the thing, and I'm so happy that the people are continuing also. So as a complementary medicine, I think it is a good adjunct with psychiatric practices. Thank you, sir.
Thank you, sir. In fact, Professor Madan sir used to make a very nice one-liner. He said modern medicine has side effects. Sridharan sir was saying, you do yoga for one problem, you will find an improvement in some other problem. So it is the whereas in modern medicine you take it for an ulcer, you end up with hypertension. Then you take for the hypertension and end up with diabetes, and you know what, we keep on going in a circle. So side effects in modern medicine, side benefits in yoga. So when you combine them, you make sure that neither you are going to have those side effects. As Sridhar sir said, whatever toxic effects are there, you are mitigating it. And the main way we are mitigating is by reduction in dosage. So a person who needed, say, 20 milligrams of a drug, when you add yoga, may only need 10 milligrams. Hence, the side effects are going to automatically come down, because with the medicine, 10 milligram will have 10% side effect, 20 milligram will have 50% side effect. It's exponential. The side effects are not, as you increase dose, it doesn't go, it goes exponentially. So when you can reduce even by half the dosage, the side effects come down, The cost of the drug now is less because only half the drug.
Health
So
improves.
cost comes down.
Health improves.
So cost is less, side effects is less. Patient compliance for the modern medical treatment will also be better. So yoga, when you add it, you are enhancing modern medical management compliance also. It's a very beautiful mix when we look at it. So this is a beautiful question with some nice points.
Saving money on the drugs also, half money. So yoga will enhance and ennoble the modern medicine.
Enhance and ennoble modern medicine. I love that. Ennoble.
Yum is there. That is we are teaching not only us.
Enhance and ennoble. I love that. Enhance and ennoble.
So I think I would like to take it forward to Yogacharani Kathy Davis. So you have had 4 to 5 decades of experience with midwifery as a treasurer of the Royal Society of Midwives in UK, and you also are a practitioner and a teacher in yoga, teaching the Geetananda practices all around, right? So what do you think is complementary? Do you think there is a connectivity in this, or anything that can complement each other as far as the midwifery and the yoga teaching can go?
Without doubt, complementary side to teaching yoga to pregnant women. And my experience was some years ago now, where I, because yoga at the time wasn't accepted in the way it is now in the UK or in Europe, I had to sort of be a bit devious. I think it's all right to be devious sometimes. So I set up a program of yoga-based exercises for pregnancy. and what that was saying was that these exercises are based on yoga practice.
Could you call it yoga or you call it only exercise?
Call it yoga.
Ah, okay.
So both things were in. So to pacify my employers, I had to say it was yoga based because it was something a little bit, we don't know about that yet. So I devised a program for pregnant women from when they were about 20 weeks. Not because I didn't think they could come sooner, but more about how many people you could get in the space, really. And the outcomes, I was teaching them pranayama, and I was teaching them certain yoga postures and asanas that would help them through their pregnancy and help them stay relaxed in their bodies, and then different techniques for relaxation and getting their bodies into comfortable positions, of course, when they get very heavier with their pregnancy. The outcomes, which I wish I had some sort of device from Dr. Sethi sitting beside me to measure, at the time it would have been lovely, but the outcomes were really reductions in cesarean section rates.
Okay.
A lot of the women delivered had their babies in our midwife-led unit, which is totally outside the obstetricians. Sometimes they had to be moved to the obstetric unit, but most still had vaginal deliveries rather than cesarean sections. And their recovery afterwards was much quicker because they had certain types of knowledge that they wouldn't have had they not attended. I was also, because the system I devised was quite fairly simple, not complicated, I was able to teach other midwives how to teach this system. So it wasn't just dependent on me. So if I was away, there was always a class going that we could attend, and that went on for quite a number of years. Now I don't know because I'm retired.
So thank you so much, Kathy. I think you need to be, giving a lecture or share your experiences with our OG department here, because they'll definitely benefit from it. because we still not, we don't have much of the OG interventions as of now. So let's hope that, with your experience, maybe if we can share it with them, we'll have more of, work with OG also. Yes, yes, we will think about it. So the next question I think would be to Maruti sir from Suvubaya. So in yoga, we believe we have the subtle astral body with prana, mind, etc. So some claim to measure the changes in this subtle body with scientific equipments. So are these truly scientific, and is it possible to measure the subtle changes or spiritual experiences? So do you have any device equipment to measure that?
I think this discussion is really very, very interesting. I am also learning many things. I think whatever it was told, I would say every discipline of science needs amalgamation. As we say, integrated medicine. So I think the adverse effects and the benefits with the reduction in the dose of the medication what we give, I do believe all kinds of science, but we are not expert in everything. See, I'm not expert in Ayurveda, but still I believe Ayurveda because I used to prescribe for many for renal stones I have prescribed, not even a single case has failed. So from Himalaya drugs. So I do believe, I trust them. And I do give my medications also along with that as a adjuvant. So the question is addressed as subtle changes. Can we measure that? Yes, definitely we can measure. The small changes in the heart rate variability, which is related to heart functionality. So that can be picked up by heart rate variability, spectral analysis, which majority of the allopathic doctors are not aware of. They think HRV is HRV. This is at research level. So we can't reach. The first thing which comes to everybody's mind is we cannot do HRV in clinical scenario. So it requires a laboratory, well-established laboratory. But I have actually made the device which I have shown. It's a portable device which can be used even in the OT situation. I have given it to an anesthetist in NIMHANS, and then that PG, postgraduate, she completed her thesis with this device because she could carry it into the OT. For HRV, inside the OT, how she can do? She doesn't require a big equipment like Biopack or Power Lamp. So she collected the heart rate, the ECG, in a laptop, in the OT room, and she completed her thesis. So like this, my instruments are portable, very easy, safe. They are battery driven, no electrical hazard, and the ethical committees don't have any objection because they are non-invasive, and they are actually very cost effective and user friendly. So this way it gives very powerful results which can even detect that subtle changes in the body systems. So it definitely helps. That is my answer.
And thank you so much, sir.
We know that here Dr. Amal will be more appropriate. Psychological measurements and the changes which occur in the heart variability, sympathetic, parasympathetic, and underground changes, which will occur when significant changes are there. With body, mind, and soul are Satyam Atma Shri they need to deliver. They mean to deliver. Satam better than mind. Atma, Shri body also. Father body, then other thing. Or if murder loss. You are the BC. So he can body each other. Body pain is there, underground change will be there. Autonomic change will be there. Vice versa. Psychiatric problems are there, body change will be there. So the psychiatric disease, sympathy parasympathetic, see relationship between endocrine, autonomic function can be in many ways. blood pressure is there. Even you need the dominance also. But that takes time to manifest, maybe. That is a part of this right in the nadi. Which often not very easy to do, it happens. So, you need to keep these things in mind. And also think of something like activity, rather than very complicated. For me, also it is better. That is yes. And then this also.
As I told, the critical fusion frequency gives a good idea about the neural processing speed, which always get deranged in most of the diseases. And that's one very simple test which can be performed anywhere. You can do it anywhere. It can be in the bedside, or it can be in the house, or it can be in the lab, anywhere. And this AV reaction time also, the neural system, the entire neural system which is disturbed, can be measured for subtle changes, but a very good accuracy of milliseconds.
So did you say that the flicker test could be done in groups also?
No, it can be done individually, but I demonstrated in group.
Okay. No, but I thought it could be.
Demonstration sake, I showed it to everyone, but I have volunteer for whom I was assessing.
Okay, so it has to be done individually.
Usually it takes two minutes.
Okay.
So the accuracy of this AV reaction time is also very accurate. Small changes also can be picked up. Even the temperature threshold also is one of the good indicators. Like the pain threshold after this yoga practices will definitely change. I think that's how this OB department, the pain threshold will definitely alter, and they have a painless delivery, and they experience no pain. Like this is how that works. I mean, pain threshold can be measured. I did show a device which has a temperature threshold. I didn't demonstrate, but I told them.
Okay.
And the respiratory pressures. Definitely, if you do breathing exercises like this pranayama or the breathing techniques, slow breathing, all that, definitely they influence the physiological parameters which can be measured. That is what I divided system-wise: respiratory system, cardiovascular, and then CNS, psychomotor skills. If you are alert and awake and you are conscious, you can do many things better. Your scores will be better. I have just tried my best to demonstrate.
So measuring these physiological parameters, could it be correlated with the psychological also?
Yes.
Yes, sir.
It can be correlated.
Yeah. Thank you so much, sir. This question is to Yogacharani Devasena Bhavanani ji, who's a dancer, a Carnatic singer, and a Yogacharani herself. So the question comes from Sububaya. So are there any direct references of yogic practices like asanas, pranayama, dhyana, etc. in Natya Shastra? And because we see many yoga postures being used in classical dance forms. So can you correlate like anything from the yogic literature? Is there Natya, Natya Shastra?
Namaste everyone. Of course, the dance form, it's a karna, the part of the dance is karnas. That is exactly like our asanas, what we do. That's what Ammaji did. So Ammaji was teaching the kids. She loved to teach the kids so that she can bring them from the young age. That's what her passion and love. So she was teaching them the yoga and dance both, so that they could easily do. Because in the ancient times, people are very flexible. Nowadays, in the modern time, we are just sitting and eating in the chair, or like they is telling in the afternoon, oh, I don't like to stand and eat, because the traditional way is sit and eat. So everything changed. So nowadays, we are not really flexible. So that those days, the ancient, they are very flexible, so they could go to the any position very easily. So of course, Lord Raja, who called the king of dance, so of course he's the king of dance, of course he's the Yogeshwara. So he could do any postures in the ancient temples, the big temples, because the temples also related to the Pancha Mahabhutas. So easily you can see, like the Tiruvannamalai, Chidambaram, those temples you can see, most of the time Swamiji will take the group, even though when they are here for the course, they will take up to the Tanjore, at least Chidambaram, Tiruvannamalai, like that. So easily you can see the postures, even in the postures you can see very easily, even though it's lifted totally, that Lasya, Lakutvam, our Ji was telling in the top. So like Lagutum should be there, whatever you do. That's what Yogana Amaji says, that whatever you do, your mind should be there totally, so that if your mind and body, everything is there, then you see the beauty in that. So you see that essence easily bring out. So like that you can see in the statues even very easily. So the postures, they could go easily ancient times, of course. Nowadays the kids are not really even balancing or even come to up to the dance. You don't have like doing like a ballet like that and all on the toes, but still you just when you are practicing even like just going up to the toes and lifting up the toes, that even sometimes we feel like very difficult the balancing, you know. So like that very difficult nowadays for the kids. So the Ramaji was teaching them yoga plus dance both, so that they could do easily, because many top dancers did the research and all, but not really practically they didn't do. So all the credits goes to Amaji, of course. Amaji Swamiji made the whole structure in the ashram that we could learn dance, yoga, singing, chanting, everything comes in the structure, so that it was easy for them to balance. Of course, sitting in Narayana even it's not easy, that you have to go like tay, yeah, tay, tay, yeah, tay, 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 tay. It's not really easy to sit and do in the Arabic even. So that's what Amaji brought, that energy in everything. Amaji Swamiji is singing. Like Amaji appreciate always, because the ancient dancer, they can sing and dance. But nowadays, we always have the singer, you know. So like that, it was very easily done. You can see the postures in the temple towers, all the like our Natarajasana and all. You can see very easily, very exactly like when we do the Nataraja, the Black Shiva position we do. Many postures like that, very related, exactly like our asanas in yoga. Of course, that's what Amaji brought back the karnas, back to the dance. Because part of dance, like 108 different postures, then it's gone totally from the dance postures. Because it's brought in the dance form, Nati Shastra, it's like a Kutu form, that the dance drama form it was there. Then slowly we brought it to the individual. Then slowly its Karnas part also gone totally. So the whole credit goes to Amaji to bring back the Karnas into the dance. So many postures is there, like Chakrasana also there, Dhanurasana, all leg lifting postures, like Ananda Tandava, like a Trivikrama, Natarajasana, many postures you can see in the temple towers.
Thank you so much, Devsena Miss.
I would like to add something. This dance actually requires fine motor activity, coordination, and precision of timing. My pin dexterity test will definitely tell what is the status of a particular person. In case if I do a pin dexterity test for madam, I am sure she will have the highest score. And if I do it for a person who is sedentary, it will be very low. So it can definitely pick up eye to hand, fine motor activity and coordination. It's a very simple tool and it is non-expensive. And you don't have to buy anything for that. Simply we can do it. I wish some of you will take up such studies and and even the pain threshold. Like you check for some people who are at, before pregnancy you check, during pregnancy you check, give these therapies and then evaluate. In fact, one study which I am going to, I just mentioned, first semester we are administering music. This is happening in Vanivilas Hospital in Bangalore, and it is going on from past 7-8 years. And first trimester, they have not conducted any scientific studies so far. So I just guided them. You collect the HRV for the first trimester, second trimester, third trimester. I am actually analyzing the data. First trimester, the stress is too high. Second trimester, it has come to almost a reduction by 20 to 30%. So I am scientifically documenting it. It's a 50-50-50 study. 150 pregnant females we are studying. I mean, the same pregnant lady comes 3 times. So these assessment tools are very useful. HRV can be applied for anything. Only thing is you have to design. The study design is equally important. So I can assist you how to design the study and what should be the outcome, what you anticipate. Study designing and getting the clearance. I think here most of them are non-invasive, so ethical clearance may not be a problem. So only thing is your design, effort, and prove it scientifically, then the publishers will easily accept. And you are noticed in the eyes of the non-scientific community
Yeah.
That's a big question. So we can solve this question by basic, simple research.
Thank you so much, sir. So next time we have a PhD student getting, scholar admitted here, I think we'll definitely consult you, make you an expert in the RAC, and take up your suggestions so that the thesis work, could be enhanced further. Certainly, sir. Thank you.
Question of planning and design, which is mind. Mind is the best laboratory and best instrument, which rishis had. Other rishis, astrology, all this, astro, yoga, Veda, yoga, how they want it, how they perceived it in meditation. Whole Ayurveda has one meditation. Dada Bhuta, all they had mentioned, Samhita, Sutta Salam, they mentioned the rishis, they sat in the Himalaya, Himmate Shive, Pashi Himmate Shive, then they will name also. All the names of the rishis. Then they went to how to remove the disease. Then to start Dhyana Masita. Then they went saying this, they went Dhyana. And then there's Shiva, so they give their mind. So meditate, science should meditate. Meditate, meditate. You are young, meditate now. You're a scientist. You are not a scientist in that way, but you're a very spiritual scientist. And you will identify you are apart. This is my idea. God, Shiva told me, you do it. Keep doing it.
So next question to Ananda sir. The challenges of giving yoga therapy to the current generation who lack sleep, who will not follow instructions or diet regime, who is constantly stressed with poor follow-up and compliance. How is yoga therapy challenging, and how would you think you can overcome such challenges?
Actually, there are two ways to look at a challenge. One is to say that it is so challenging, I won't do it. That is tamasika guna. The second is to say it is challenging, I will use the challenge to enhance my capacity. And in doing so, we use our rajasika guna to move into sattvika guna. So, when we work with the young people, it is easy to say they are difficult. In fact, Divya in her psychology studies, they keep on saying this is a difficult age. And they keep on saying that now we studied early childhood, late childhood, now we have come to early adulthood, they still say it is a problem age. So I don't know when we don't have a problem age. So I think we are always having a problem. But especially the young people, because they are seeking companionship. They want company of their own age group, not elders who are going to advise them. So if you want to bring yoga to the young people, first of all, stop advising them anything. Because the moment you advise, they will shut off. They have a very good shut-off system. So how do you then communicate with them? You communicate by becoming one with them. You become youthful, you become childish, you become childlike, you start to move with them, you play with them, you sing with them, you become their friend rather than their teacher. So the way you captivate the young people is by becoming the friend, and by being a friend you become a teacher, rather than saying I am the teacher, you are the student, and then they shut off. So it is very important that when you want to work with young people, Maitri Karuna Mudito Pekshanam, that type of attitude we have to take. There has to be that understanding of when you have Maitri, when you have Karuna, when you have Mudita, and then sometimes Upekshanam, leave them to sulk, come back after an hour and they are normal. Now it is easy to talk about it, tough when it's your own children. That's a different issue, we all parents know that. Easy to teach other people's children than your own child. This is common. So the first thing is, it should be fun. Young people want it to be fun. So find how that therapy, that training, that teaching can be made fun. How it can be given in their language. You have to speak their language, not expect them to understand your language. And this is why Einstein, who I love so much, that is why Madan Mohan sir is our Einstein also. Einstein made it very beautiful. He said it has to be made simple. If you understand a topic, you will make it simple and digestible. And this is why any speaker who complicates matters doesn't understand the subject. So this is why for young people, they will immediately understand whether you know your subject or not. Bring it simple. Give it day-to-day examples. Give them practical things they can do. And then you will have them for life. But if you want to be in that Acharya Sthanam, and you say, I am going to teach you from here, they will give you some four-letter word and they'll walk out. So, most important, be a friend, and as a friend, you become their guide.
I understand that perfectly, sir, because while teaching the special children, so it's like the children without legs. So you have to get down to the floor to teach them. Otherwise, sitting or standing, you will not be able to relate to them or get in touch with them or make them do anything. So like sir says, like you have to practically go down to their levels, make them understand. Don't make it too difficult so that it is not digestible. So don't chew, don't take into your mouth what more than what you can chew. That's something, And again, in continuation to the same question, general public consider yoga to be physical and yoga therapy as physical interventions. But yoga therapy intervention is beyond that. What are the challenges you have faced in regard to working with so many people as a yoga therapist yourself?
Well, we cannot deny that yoga has a physical component. So this, I think the danger is there is a misconception. Dr. Rama Reddy has written a beautiful article on misconceptions in yoga. Myths and misconceptions also based on this. So often people think yoga is only physical. So then many of us in yoga, we start to say, no, you are wrong. Yoga is all spiritual. And what happens is, it is two ends of the spectrum. We forget that yoga is the whole spectrum. The whole spectrum is yoga. The physical is also yoga. The non-physical is also yoga. The metaphysical is also yoga. And this is why the impact of yoga as a therapy is happening at multiple dimensions. It is happening in your Sthula Sharira, it is happening in your Sukshma, it is happening in the Karana Sharira. And that is where the question came that how do you measure those? The least we can do is measure the Sthula Sharira and the functionality that is of the Karana Sharira. So physiological functions already imply you are measuring the flow of prana. Why is the heart beating? Because prana is there. So when you measure HRV, you are indirectly measuring prana. Similarly, when you want to understand manas, you can understand it by some of these tools. The cognitive tools give you a glimpse of the functionality of mana. So what we need to communicate to people is, don't put yoga in a box. One of my commonest statement is, if anything in a box is dead. So if you put yoga in a box, you just killed it. Jada yoga. So we don't want Jada yoga. We don't want dead yoga. We want a living yoga that is thriving, throbbing with life and nourishing and flourishing. So for that, we have to understand yoga works at the body also. Yoga works at the mind also. Yoga works at the emotions also. Yoga works at the spirit also. And yoga works on society also. When Sir mentioned Yama Niyama are enabling our social health to be of the highest quality. When you have self-control and when you are very contemplative in how you relate with others, your social health dimension will enhance. A common link that can be made, very simplistic, not perfect, but a good link. Yama Niyama enables social dimension of health. Asana pranayama, the physical dimension of health. Pratyahara dharana, the mental dimension of health. And dhyana samadhi, the spiritual dimension of health. 4 dimensions that WHO talks about: physical, mental, social and spiritual. And all 4 dimensions, Maharishi Patanjali has given 2 anga that can be directly related to it. Now I am not saying yama niyama do not influence spiritual health, but just for simplicity, for communicating, how do you talk to the doctors about it? Because here we are working in a hospital. I cannot go to the doctor and say that your patient's prana and the apana is not working, so I am going to give 3 asanas that will enhance the prana and the apana, and then through the sushumna I will have the flow of prana and create health. They will kick me out of this institution. Because they will say, what nonsense you are talking. So I have to tell them, your patient's blood sugar is high, your blood pressure is high, that problem is there. Hence, we are giving the appropriate yoga therapy that will enable normalization of those functionalities. But as a yoga therapist and as a yoga therapy guide, I remind our students, you have to make a yoga diagnosis. You are treating a yoga diagnosis, not a medical diagnosis. You have to understand, is the prana deranged? And create a yoga therapy protocol for the derangement of prana. But don't talk like that to the doctor. Tell him, your HbA1c is high and we are bringing it down. So we need communication skills. That is the most key element. How to communicate with the medical professionals. How to communicate with the lay people. How to communicate in a scientific form, how to communicate with children, and most important, how to communicate with your own self.
Thank you so much, sir. So, beautifully put out.
You said Yam is spiritual.
Social.
No, that's social pakka. No. My point is religion and spirituality, Sanatana Dharma, Sanatana Manav Dharma, humanity. Basic there. The morality is most about Sanatana Dharma. Secondly, we said the 4 dimensions, spiritual, this one. Also environment. See, Yogi Krishna. What's that? Vishnu Darshan. Vishnu Darshan, he identified the whole creation. And what Modi ji said for the environment, he said in that first lecture there. That's also there. And one more point is there that there are basic points. Basic language, basic term, which should be there. Hatha yoga should not be confused with yoga. Yoga is whole. Dhyan yoga, what are there? Hatha yoga is that. We know what is hatha yoga. That's what we are doing here at international level. Hatha yoga, don't confuse with yoga. Hatha yoga is not yoga. ये only भ्रांति है, distortion. That's what it is. And the religion should not be confused with dharma. Very clear. That's what it is. Because only otherwise everything becomes distorted, confused.
In fact, speaking of religion and yoga, I would like Ramareddy sir to comment on that. In his recent study, he is planning a letter to the editor that religion is not a bar to yoga therapy.
I was a bit skeptical about certain things because in our Godavari districts, lot of conversion, and although officially Christianity only 5% or 10%, but unofficially almost 40% people are following Christianity. So I worked on different modes of yoga techniques like Surya Namaskara, asanas, assorted asanas, pranayamas, Omkara Japa, relaxation activities, and energizer activities, and basic exercise. So when we posed to them about this Omkara, would you mind uttering Omkara? No problem at all, we can utter. Then we asked, do you attend any church? Yes, regularly we attend. Your pastor anytime said that you should not utter Omkara and you should not wear bangles and kumkum. Of course, he says regularly. Then if he discourages you, what do you do? I do not know what to do. So what we find is none of the patients just antagonized against the certain things like Omkara or any other rituals like associated with yoga. So that will not be any obstacle at all. Only thing is we have to sensitize the pastors about the thing, and maybe we have to conduct in future some comparative studies like instead of Omkara, you will be uttering Yehovah or Jesus, and will there be any difference between these two things? And indeed, Sridharan sir, I know that he is a Vaishnavite, but he has to talk about Kaivalya, not about Parampada. Although he is so there will be always some difference between our practices and our ideals and the environment. There will be some conflict, but religion will not be a bar for practicing yoga, whatever.
Thank you, sir. I want to tell you one thing. When you thought this morning, I did not have that mind. In Kevalyam, particularly in tradition, one thing is we are not supposed to impose any of our belief on the other person. And I had the greatest privilege to teach a non-believer, a staunch non-believer, anti-God, anti-Vedic personality. For 2.5 years, I used to go to his home and teach. And we gave him a particular, we wanted to learn jhana. It's very important, that's why I'm taking a few minutes to explain. See, he said, I would like to learn jhana. My teacher will come with me, then I will go and teach. My teacher said to us, he said, please tell your teacher, I don't believe Vedas, I don't believe in God. And he said, you need some visuals, you need a particular sound, not mantra. You need a sound, you need a visual. He said, okay, choose. So he said, rising sun is common, have rising sun, okay. Then sound, he gave us sound in Sanskrit. The person did not take it, and he said, make it into Tamil. Okay. Next day, I went there. He chose something from a Tamil literature and gave the mantra. That person. So, we go on the basis of your own belief system. You will come back, and we don't impose anything at all. And this is for me, and this is not for others.
So I was mentioning about this pregnant study which was ongoing. There, the mothers are actually not imposed to listen different language, whichever language they are. Like they choose the music which suits them. We don't choose. Like the different religion, whatever that they believe, we make them listen to that only. So we don't impose that they have to listen this or that. So whoever wants whatever they want to listen, let them listen. But we select those which give them soothing information. So there are a set of music, mostly instrumental. It's not vocal. So that's what I do.
Just I would like to.
We have a Vedic chanting department in which we are teaching chant mantra, and people from London they come. They are Christians, they go to church, but they will chant Gayatri mantra better than anybody else. That is different. I go every day, every week, and go to church and do that, but we chant every day. It's happening. It's happening now.
I just want to add, of course, on a personal.
How the old level-rich mind, level-rich, the vibration is there. Any other name you see how it's level-rich. Suppose Ram, it's not actually level-rich. Oh, level-rich. Then not a chanting in a group. Just saying things, keep life flow. It's level-rich. And that's the effect. That should be kept fine. So let them not accept.
No, I think the time is changing. That I have a experience that I was invited by a very popular renowned church at Bangalore to train their what you call fathers, the church fathers, I mean. So to train them very frequently, like weekly once or something, I was supposed to go there and then take them a class. So when I went in the beginning, so I was confused. So how do I start? We start with Sahanavatu and all our mantras, whether to, they're all generic chants, but then whether to do it or not, whether they will accept or not, and then I was very familiar with so many Christian chants also. I had my complete schooling at Christian school, so I can quote from the Bible. So whether to demonstrate all those, but then it becomes like I am, doing something. So I didn't want to, so silent. I said silent prayer, and then we start with this. Then when we went into various practice, then the chief who had called me, he said, you have Surya Namaskaram. Surya Namaskaram we always do with the chants and all. But I avoided the chants, and then I did. Then he came and told, sir, why did you left the mantras? You chant the mantras and then Omkaram, it's a Malayali, this thing. So they said, you chant the Omkaram and all in between. Like this. I said, you don't have a problem, then why? So I am so happy to do it in my own. He said, you do it in your own way, that is why we want you. So I did all that, and then they all enjoyed chanting the mantras and everything, and then it was over. Then I went to the room of the chief father who had invited, and then I asked him, sir, it's so nice to see that you are welcoming all those, and then gives us also a nice way to do it in our, he said, see, we want yoga to be given as it is. Now the popularity of yoga is such that even people here, they want it. It is universe. Correct. So he said, we want it as it is, so that we don't want them to go elsewhere and then learn. We would give them as it is. We are open for it, which not just the community, but to the leaders of the community, they are learning. And I see at places like our SVASA, many, especially from Kerala, of course, whatever people would say they have another agenda or something, but we are open that they come and learn as it is. They chant, they follow all those, and then go back and they probably practice also. So that shows we don't have to, in fact, change for them or something. Even as it is in our tradition, what is there, they are ready to accept today. Worldwide, we are seeing this like what you quoted. Thank you.
So they are looking forward to it because in my experience, I can share that the whole of my PhD thesis, the whole of the intervention was done at a hospice of St. Cluny. And the subjects for my study were all the sisters, even including the Sister Superior, Mother Superior. So they all participated very happily, voluntarily, and like you said, it is happening now. That is.
At the same point, in the early Yoga festival, there was a meeting there, one Sufi was there from Kashmir. He raised the point that secularized yoga. Secular is very fancy term. It is not secular, it is good, but very fancy term. So everybody is happy, clap. They know it is secular. What do you prescribe? Say, oh, don't do that, that's the problem. I say, what do you prescribe? You are very secular. You don't want to chant them, I'm going to force you. Don't chant. Chant something else. We will not secular. You keep it like that. It is secular. There is no force to you. Finish.
So the next question to Dr. Maruti sir. If HRV helps to prevent mortality, like you were saying, why is it not indicated in any of the health checkups? This question is from Dr. R. Balaji.
HRV can identify subtle changes in the variability spectral analysis. And to do this HRV, I think we require standard equipment. That's what everybody thinks. I have done my instrument way of doing HRV, which has been validated with the available gold standard instruments. So that is what I want to actually stress upon. The instrument which I demonstrated today is validated for its performance with a gold standard device, which costs about 8 to 10 lakhs. So there is no difference between that and this. And that's how it can be used as a screening tool. But people need to be trained, and they must be told about the importance of HRV in a screening session. Like most of the clinical doctors, they don't have much knowledge. I would say that they don't believe that HRV can be done easily. It can be done only in the laboratory level. That's what they have a preconceived idea. That needs to be taken out from their mind. And a physiologist is a better person to interpret and say about it. If the clinicians also start inclining towards the reports and starts learning more about HRV, I think it will become an excellent screening tool. It can be done within 15 minutes.
Physicians, they are more clinicians. So they are only worried about to see the ECG. So they are looking at fibrillation, is there any fibrillation, is there any T1 inversion or inversion. He has got a research mind. That is why he is studying HRV. And this is the idea, it should percolate to all the physicians and clinicians. Then it will come into the practice in another 10-15 years.
Actually, with HRV, it is not coming to the clinical profile, but it's coming to the public profile. Especially Western countries now, they all have these special watches, which are all HRV. And so many of my yoga therapy people in USA, I checked my HRV today and like, which lab they went to. And then I realized they have it on a watch these days. So, I think this type of, as it becomes popular, now some lab will come up on it. They say, no problem, we'll do HRV analysis, 999 rupees only, with the family discount if you have 2 people, another 333. Because, the thing is, most of our clinical investigations, we are trying to find something which immediately we can do something. With HRV, the thing is that you know that something is wrong. The question comes, what do you do about it? So here, this is where it's more of interest to somebody from yoga, because we say, okay, if you have an issue with your HRV power is low, or there is an issue between LF and HF, then okay, let's do some pranayama, let's do some relaxation. We did work with cardiac failure, where we again showed amazing work there. Because in cardiac failure, there is also a sympathetic tone coming up because of the cardiac failure, which is often missed out if you don't do the analysis. So the yoga therapist should become more acquainted with HRV. What Sir has is such a cost effective. I will not use the word cheap because cheap has two connotations. It's a cost-effective model that makes it accessible for the yoga therapist. They could have it in their room, they could do an analysis and say that, okay, this is what it, a basic primer of understanding, so that you understand autonomic function, because autonomic function is one of the chief indicators of how your yoga protocol is working. Is your yoga protocol working or not? HRV can give you a very good tool to evaluate the effectiveness of your protocol. Because are you rectifying an imbalance of autonomic function? Sir used to always remind us, everybody goes around in the yoga circle, they say, oh, yoga will make you parasympathetic dominant. Yoga will not make you parasympathetic dominant. And people have this idea. He said, it brings about autonomic balance. Homeostatic balance, autonomic balance is what yoga wants. Samatvam yoga uchate is all about equanimity and balance. But because people's parasympathetic is so low and sympathetic is so high, when we get a finding, we tend to interpret it as if it's becoming parasympathetic dominant. But actually it is restoring sympathetic balance. So I think, if a yoga therapist can understand this, make a basic investment, you can start to evaluate 1 week of your yoga protocol. Is it rectifying the autonomic imbalance? 2 weeks, what is it doing? Is it increasing the sympathetic or is it decreasing the sympathetic? You can modify your practice. It can be a good tool for you to evaluate your own therapy protocol, not just from the patient point of view, but your protocol point of view also.
Autonomic balance is very important, but what I would say, physiological functions are very normal. Or you can say, homeostasis, autonomic function is very important measurement also. The homeostasis is stored. If your body weight, blood pressure, also the autonomic is autonomic, but easier to measure, blood pressure as well. So there is basic physiology, minimum physiology should be taught to every yoga. Small book of physiology, fundamental physiology, every yoga therapist I think should know. How to do it, that's a different thing.
In fact, one of the studies at Jimma, was with people who had long-standing hypertension. And initially what happens is that, we had done all the autonomic function tests, the classical tests. And at the end of that 6-week period, we did it and we found all the good changes and all. But one thing which also changed in that period was sympathetic function also came up, along with the parasympathetic. Because what happened, at the beginning of the study, the sympathetic was subnormal. With regard to the isometric hand grip and the response, you see how much the diastolic pressure goes up. It indicates a sympathetic tone. Even that tone was lower for the hypertensives, and at the end of the 6 weeks, that tone came up. So it is not just this, it's easy to say sympathetic comes down, parasympathetic goes up. It's something much more than that, which is why these tools are so beautiful.
Now also, you mentioned that in the beginning of yoga practice, when you teach, you'll be tested. You don't do properly. So it's better to go. Once you learn, you'll be comfortable. Then it will be different. So initial measurement, so even when you give some anything, you are measure to your trained person, untrained person, or being trained. The difference will be there in the observation.
Kathy, a question for you. I don't know who wrote it, but is there any, the complementary alternative medicine, CAM therapies, is there anything like that which is integrated in the midwife society, or is it like coming up in UK about, all the alternative complementary therapies? Are they being integrated into the medical setting?
Yes, I have. It has been for some time now. Acupuncture is used a fair amount, and acupuncture for turning the breech baby. So that's one way. As far as medication goes, it's still sort of a no area. When women are pregnant, although they were having COVID vaccines, so that was a one-off, really, I hope. But the yoga in itself is becoming more popular. I mean, the time when I started with this, it was sort of a little bit sort of breaking through, and as Dr. Ananda was saying, it's learning to speak with the medical profession without using words that might make the hair stand on end. But that's becoming easier, and I think the outcomes for women, reducing on smoking in pregnancy, the life awaits baby, the premature baby, all of these things seem to have been reduced through using, as far as I knew, the yoga techniques. But I do know that midwives were using particularly acupuncture and combustion. I can't quite remember what the name is, but using acupuncture and then heating, which seemed to help turn breech babies in particular.
So there is some integration happening.
It certainly is, yes. And in Western society, I don't know about India so much, but in Western society, yoga is a big word, but unfortunately, it's just stuck with hatha yoga, which is slightly annoying. But I don't know how you solve that problem. I think it goes through phases, really. So women may well turn up just to do some exercise, but may get better benefits from it.
So when you say exercise, maybe they relate more to the asanas.
Yes.
So that is why, the physical exercise and all these physical practices are more what is yoga for them. Like sir was saying, it's not just hatha yoga, there are other streams also. But the more familiar thing for them could be, the hatha yoga practices maybe.
They may well go to a yoga class
So the last question to Devasena Miss, how yoga and dance helps to develop positive impact in health and wellness, well-being. So.
Last question also going on like a sympathetic, parasympathetic and all. I think Swamiji, without having like a thesis and the research and all, he was doing many research. Of course, Madhumohanji doing with this, Swamiji Darshan. So Yoga Master Dr. Swamiji Darshan, our Guru, he made like pranayamas, like doing the course people when they are there in the ashram. They are preparing the postal. Then they are there. Like it's done like a step by step, slowly moving. Of course, he did like going like that because he said it's yoga's way of life. So he was giving the practices like like we have a pranayamas, they will go like even Katiji will be teaching every Friday they are going on like one round. As Amali says, it's like the regularity, repetition and rhythm. So 3 hours she gave the importance. So like that they are going like a Vibhaga pranayamas, they will take for low for 1 week. So they are experienced with that. So with the experimental they are making themselves, it can actually like a yoga therapy. Like yoga therapy means as like Nanda says, that you should give therapy even for themselves. The people comes to you, that yourself itself like a yoga therapy for them. Just like many of them will come and talk with him and go. Then by the time when they go out, they already like a 70% they are feeling a lot better with them. So with the dance and yoga, of course, Swamiji made the structure like that's what we brought up in that atmosphere and the age. And so this giving like when you dance, of course, you feel the energy. Of course, with the dance, when you are putting your body, as I said, in Narayan, you are sitting, you can see maybe Divya can give the demonstration. So you can see many angles actually. Like a Trikonasana, when you are going, you are putting your body in that Trikona, like a triangle posture. So you can see many angles actually when you are putting your body in the alignment itself. You can see the triangles with the hands, and when you join the line, you can see the triangle, and of course the foot up to the knees one triangle, other triangles, many triangles you can see in the body shape itself. So that's how this she has to do. So yoga skill in action, as Bhagavad says. Yoga function. Yes. So Trikonasana, when you are putting your body in the Trikonasana, you are making the Trikona, making the energy, the stimulation, the position itself. You are telling the body, as Amaji says, yes please, you can release and go to the opposite side to balance. So Amaji says like it's like giving the stimulation, the body language, as sometimes you go, even the music that we are doing, you can take your time and release. So when we are doing like body relaxation and body language, Amaji says, because even though we are in Pondicherry, body don't know the French actually. So it knows only the body language. So like something is in the hand, we just go, just to shake it out, we are going. That's what in the book of Astrika is very cleansing prana, very strong. And before our whatever we are going to do the pranayama, we start with the book of Astrika, we go like totally cleansing yourself before we start any pranayama. As G is in the top, when the movement starts, the breathing starts. When the movement finishes, after that you are continuing. So like that you are there fully, you are with the body, mind, emotion, fully you are there. It's actually balancing everything. So the body knows that if you are going to say like, no, I don't want to throw out. But this body knows that, okay, you are telling me not to hold. So the body language we are making in that. So the position we are making, putting like mandalas in that. So the position, so it's good. Of course, in the dance, unnecessarily, we don't bring even the chin down. As the Bhagavad Gita says, concentrate the nose. That's what Ramaji says, keep your elbows up, chest up, chin up. That's the gesture make you that whenever we are worried a little bit, then automatically we bring the chin down, automatically his face shows now. Why you are feeling that today? Automatically shows in the face. So that was keep the energy. As we say in the English, he's on his toes. On his toes, so ready to do. So skill in action. So everything brings in yoga and dance together. That's what Ramaji says. They brought up, they are pioneers of many arts. Not only yoga, dance, music, chanting, singing, of course the whole cultural they brought up and bring the balancing. So already already they were doing the Saruta Genesis, the feeling, Sukasthanam. That's what Samaji says, like in the therapy class, we are the Shavasana, oh, we feel our comfortable zone. Samaji says, the comfortable zone, we feel the Sukasthanam, that easily happens when you are singing, dancing, of course. Yoga also.
Thank you. Thank you so much, ma'am, for compiling the whole of the discussion into your, final word. So, thanking you all for making, this panel discussion very lively and enjoyable with all the inputs and